One of the things that I'm asked about, people have heard that some of the vaccine, this is a question for Dr. Redfield and Dr. Hunt. Uh, some of the vaccines in phase 3 testing evidently need to be stored at extremely cold temperatures. That's even by Wyoming standards, and that would be potentially as low as negative 94 degrees Fahrenheit. Hospitals and nursing homes, pharmacies, doctors' offices might all be places where Americans could go to get their shots. However, they don't have the specialized freezers that would be necessary to store the vaccine, especially in rural areas. So very few of those out. Is there another solution, or how can we ensure sufficient freezer and storage capacity so there's access to the vaccine and it isn't just limited to major cities?
Thank you very much, Senator. Again, there's a total commitment to work that this vaccine is distributed in an equitable and fair way across our nation. Clearly, we have, this is not something that we don't routinely do. I mentioned before, CDC routinely administers and distributes over 80 million vaccine doses a year through our routine work. We're going to build on that. Obviously, the ability to bring all the pharmacies in is a really important step. But these micro plans that your state of Wyoming will do will identify what other gaps are there. And over the next 4, 6, 8 weeks, we're going to need to figure out strategies that are going to fill those gaps to ensure that there's a proper cold storage for the vaccine distribution throughout this nation in an equitable way. We're committed to making sure that happens.
Director Redfield, do you anticipate that once the Food and Drug Administration approves the vaccine, that the centers, you kind of touched on this, the Centers for Disease Control and Prevention will have to work with the states to develop new, more detailed vaccine distribution plans? Or will the work the states are doing in advance suffice?
Senator, it's very important, and I want to stress, this is why it's so important, the playbook we put out last week and the funding we announced today, that we get these plans executed. We wanted to see the plans completed by October 16th so we can interact, share best practices of other states to try to get these plans as rock solid as possible. You know, I'm confident there'll be some things that weren't thought of that will have to be dealt with as they come upon us. But it's my expectation that each of the plans, we've done the micro planning now in Minnesota, in North Dakota, California, Florida, and Philadelphia over the summer just to get a sense on the complexity of it. Now we're looking for each of the 64 jurisdictions to complete that by October 16th, and it's our hope that that's going to really lay out the individual plan to get this vaccine equitably distributed in that jurisdiction, recognizing that there will be things that come up that we're going to have to work together to deal with as we see them, but hopefully we'll be 95% of the way there based on the planning between now and October 16th.
Thanks to the witnesses and to you, Mr. Chairman and Ranking Member.